Okay. Hi, everyone. I'm Denise Morales, and I have my wonderful Ashley Domo, who is my Vice President for Being Nurtured here. And we're excited to bring this webinar together that Ashley beautifully crafted for today's programming. And so, Ashley, is there anything that we need towards our introduction for here today?
Yes, so two things. If you have near you some supplies we would like for you to take out, something to write on and something to write with, whether that's a tablet, your phone, or an actual pencil and paper or pen and paper, that would be awesome. So we are super excited to explore how proactive self-care can prevent illness, enhance well-being, and contribute to long-term health, specifically mental health. So just a quick overview of our presentation. We're going through a special model that Denise reminded me of, as well as the critical connection between self-care and preventive care, and how ignoring self-care leads to preventable diseases, leveraging health insurance during open enrollment, and strategies to address illness caused by various factors. So that is all.
Thank you, thank you. And to get us started, we'll be doing an icebreaker today to kind of help us. So whenever we think about the stressors and the things that we're going through, and it might be um, some things that have been weighing on us from our health to our mental health to our social life aspects, we tend to hold that weight and that tension in our bodies in different ways. And so here we're going to do a full body tension release. And so for this activity, I'm going to ask you to consider and think about whenever you are feeling most stressed, where do you tend to hold that tension in your body? So when you're stressed or overwhelmed, where do you feel it the most in your body? Is it your neck, your shoulders, your stomach, somewhere else? And please put it down in the comments if you would like to share where it is that you hold that tension in your body, or also if you want to say it out loud where it is that is for you. For me, I notice that my tension is usually on my shoulders. Before I know it, like my shoulders are tensed up and I hide in them, and then I'm like this, and then I remember and I'm like, oh, I need to relax my shoulders. Or then I realize like my hands are in the fish usually by like the time I go to sleep. Um, and so here in the comments, we have a couple people stating
My shoulders also.
shoulders also. Okay, okay. And so this is something I do with my patients too, just like asking them like, hey, whenever you are feeling that tension and stress and overwhelmingness, like, do you sense that anywhere in your body? And I hear eyes, I hear shoulders, I hear feet, I hear hands. And so we're going to take a focus on where that tension is in your body. And so we're going to go in through this activity. So please sit comfortably if you're somewhere comfortably. If that's a bed, if that's a chair, wherever you are, if that's the floor for you, sit down, lie down, whatever is comfortable. And for here, close your eyes. So please, participants, close your eyes if you're most willing, if you're able to, and take a deep breath. So 4 seconds in, hold, and breathe out. And from here, we're going to start with your forehead. So, is your forehead tense? Relax it. Feel it loosen up on you. Breathe in, hold, release. And you're going to keep moving down. So, is your jaw feeling tight? So, maybe you're moving it around. You're feeling it in your jaw. And then breathe in and release. If you feel that in your shoulders, let's drop your shoulders. Loosen them up and breathe in and breathe out. And so now I want you to pay particular focus to the area where you hold tension. And I want you to put more tensity on it for 5 seconds. So right now, if you feel it pressured, I want you to hold it for 5 seconds and then release. So starting now, 5, 4, 3, 2, 1, and release. And breathe in and breathe out. And so that is one of our ways that we can go through our full body scan of tension release. So you could keep going down your body to feeling it in your stomach, feeling it in your hands, feeling it in your feet. So loosening up those parts. And so for here, we're going to start some of our stretching. And so this is in street and in chair stretching for us today. And so we're going to tilt our head side to side, side to side, forward, back, and all the way around, counterclockwise. Alrighty. And then for the shoulder rolls, we're going to go backwards and we're going to go forwards. And if you're in the chair and you can twist to the side, we're going to twist to the side. Ooh, get that little release in our back. Yep. Does somebody else's back pop? Same here. Alrighty. And then get your hands crossed over, stretch them out here. Stretch them out. Alrighty. And then calm back down. Release one more time where that tension area is. And then breathe in. Hold. Breathe out. Alrighty. Thank you, y'all. How do y'all feel with that body tension release exercise?
Feeling relaxed.
Awesome, awesome. And you can put down in the chat as well how that exercise for you. But definitely, if you're sensing that whenever you are feeling stressed, are feeling overwhelmed, and you're holding that tension in your body, doing kind of like a mindfulness guided of with that tension release is very helpful. And if you're not a person that's like, I don't even know where to start, I've been saying this for a while, but what's it called? Little John the Rapper on the Total Meditation album, he does have a full body scan guided meditation on the album. So he'll help you kind of guide you through all the body tension release if you're interested in that. And I think it's like a 10-minute meditation, but wonderful to start your day if you're waking up feeling anxious, or if by the time you're getting home you want to reset and you want to put it on, or before bedtime, you're having a hard time getting to bed because you feel like you're thinking a lot, you're holding a lot of tension, a lot of stress. Do it before you go to sleep. Make it a part of a routine, and it can help you improve the quality of your sleep. Thank y'all. And
I
can you
love
still
that.
see the screen? Awesome.
Awesome. That was really a great note to mention. Is pretty much like knowing, being aware of where your mind is before bedtime. It can affect you in various ways, and we'll get into that in just a bit. So, quick question. I really, really want to know, what is self-care to you? And do you know that it's connected to preventive care? Do you know how it's connected to preventive care? So I kind of want to hear some thoughts. This is just a moment for you to kind of think about it. What is self-care to you? It looks different for person to person. It can be shopping, it could be relaxing, it could be knowing that you got your annual physical out the way, or knowing that you got your dental cleanings out the way so you don't have to worry about it, or even knowing that you got your blood work done. So I'm wondering, what is self-care to you? And definitely feel comfortable putting it in a chat.
Self-care to me is putting yourself first and stop doing for others. Because
Okay.
sometimes we do for others so much we forget to do for ourselves.
Mm-hmm.
How is that connected to preventive care? Because if we are so busy taking care of the people, we don't take care of ourselves. We don't eat right. We eat on the go. We eat stuff that's unhealthy. We just do all the things that we should not be doing because we're not putting ourselves first.
Exactly. Thank you.
Thank you for sharing, Dr. McCullough. Self-care for me right now, since going through pregnancy, is really allowing myself to get that rest whenever my body says it needs that rest and really not fighting it. So like even before the session, I was telling Ashley like today was like a mentally overwhelming day. So like I had to take a nap. So I took a nap from like 4 all the way to 6. And it just helped me kind of clear my mind, clear the clutter and like show up and be present. And so I think that also tells us like when we don't self-care, even things like sleep, it's hard for us to show up in places where we're expected to be present.
Exactly. Thank you so much for sharing. This is also helpful. So just the way that both of you described it, pretty much brings us to this model here that you see at the bottom. So it's a biopsychosocial model, and it's pretty much a patient-centered approach to medicine that shows how biological, psychological, and social factors are all interconnected. And Denise is going to get into that later on in the presentation. So look forward to that, please. So getting into the nitty gritty, both self-care and preventive care both play a critical role in reducing the risk of chronic diseases such as heart disease, diabetes, mental health conditions. So that's everything that the both of you have pretty much described. If you're not taking care of yourself, if you're too focused taking care of other people, which they may need you to take care of them, but you're taking away from yourself sometimes. And sometimes you can go without eating or choosing the wrong foods because you're on the go, and that affects your diet. And now later on, it gets to a long-term issue, right? So that's one thing. Pretty much self-care engages in taking care of yourself physically, mentally, and emotionally. So a few things that we're going to go over is how exercise, stress management, nutrition, and sleep are all critical factors in improving your self-care habits. And then there's also preventive care, actual measures that you can do to improve your biological health. So that would be regular checkups, your screenings, your vaccines, your annual physicals that I mentioned, along with blood work. And your biannual dental cleanings as well as exams. So these are things that we do kind of like maintenance. Just like you have to maintain a car, maintain a bike, you also have to maintain yourself.
Mhm.
So keeping up with your health is very important here. So we want you to kind of, when you think of self-care, also think of the preventive care measures that you can take.
Mhm.
So that's just something to keep in mind because they're both very interconnected and play a role in your health.
Yes. And I love to give my patients the example of like a running vehicle. And so think about that moment whenever you get a full tank of gas, your tire pressure is perfect, you got your car washed, the car is clean, you got your new stickers, and you have a full tank of gas. Like that is the most amazing feeling for me whenever I am in my vehicle. And so it's kind of like yourself, making sure that some of these measures and things of like, have I gone and gone my wellness check? Have I gone to the doctor and got my dental cleaning? Do I have the things to make sure that I'm taken care of? Because if you think about it, like if I stop putting gas in my car and I'm breaking down every so often, and if I stop doing the oil change, my car eventually is going to break down. And our bodies function in that same way. Eventually, I'm doomed to break down.
Exactly. So there's consequences to neglecting these basic necessities, right? So chronic illnesses, mental illnesses, chronic illnesses like heart issues, diabetes, again, untreated and unrelated issues such as like your dental issues. A lot of people don't realize that that's neurological. And all of your dental pain that you experience in your jawline and in your face also causes mental health issues and anxiety as well. So that unwanted pain. And then other things are like small, manageable conditions that escalate, right? So pretty much like nervous health conditions, right? So with that being said, let's talk about being proactive. There's a bunch of preventative services that's out there that are covered specifically by ACA. So now is pretty much a time for you to kind of reflect on your status right now. So right now is open enrollment. It starts from November 1st, 2024 to January 15, 2025. 2025. So we're right in the middle of it, and ACA allows for us to have covered preventative services such as annual physical exams, those dental cleanings and exams, your vaccines, screenings for conditions like high blood pressure, diabetes, and certain cancers, things that do run in your family genetically, as well as your well women's visits and your mental health screenings. So these are all services that we can actually map out for the next year. So consider your current status. Do you have health insurance? If you don't have health insurance, now is a good time to get signed up and see if you're eligible through healthcare.gov. So if you have a moment and you're curious about it and the eligibility requirements, just go ahead on the web at www.healthcare.gov and you're able to submit an application today, right now. So that's something that you can do. And also considering the fact that now that you know these services are available to you, also know that it's not limited to government insurance. These ACA covered preventative services are through every healthcare insurance provider. So they're completely mandated. So that means that if you have insurance through your job or private insurance or independent insurance or healthcare.gov or ACA insurance, you can still map out these screenings that you see on the screen here for 2025.
And thank you. This also kind of gives us like a to-do list of like, what am I missing? Like, okay, I need my annual physical checkup. Like, I need my dental cleaning. So this is also like a great like to-do list of things you should be spraying out throughout the year.
As a quick reminder. So while we're action planning, we want to make sure you're taking advantage of these free services, right? So just consider a few things, and it's not to scare you, but to inform you. Family history, genetic chronic diseases, non-genetic chronic diseases, mental health as we stress. And again, another reminder to invest in yourself and schedule your appointments for 2025 so that we can be on the preventive side. This is our self-care method. So some practical tips that we are going to kind of consider here is physical activity, mindfulness and stress management, nutrition, things that you can actually do. So I do want to take a moment here and kind of hear more after you've learned about the correlation between self-care and preventive care. What do you see here that speaks out to you, whether it's physical activity, mindfulness and stress management, nutrition, or something that you don't see on a list?
I think nutrition has been the biggest one for me. So I feel the weight like on a mental load whenever I am eating like really bad foods, like junk foods, like fried foods, versus like when I'm eating super clean, like I feel clean, I feel a lot lighter and I just feel like there's less of a mental fog, which is connected to your mental health. Like nutrition is important. And so for me, like nutrition is like one area I want to focus more in. So this is also like, what am I not doing that I should probably be considering and doing soon?
Thank you.
I'm learning more about the mindfulness and stress management. I'm learning how to let go and to find quiet places to do positive thinking and letting go of all of the stress so that I can handle the stressors that are impacting my life and being a provider for a person that's my age and that's very arrogant. So I have done a lot of study and really thinking about the mindfulness and stress management. The physical activity I do a lot in the bed because I don't get a chance to do a lot of it during the day, but I'm going to improve on that. But the mindfulness helps me with the stress management. It helps me to get better.
I appreciate that. Thank you. Anyone else, please feel free to either speak aloud or put it in the chat. But I do appreciate you both for sharing because that's kind of the energy that we want to put out into the world, right? We want to think about how do we actually put ourselves first. And a lot of us are head of the household, and that is a large weight on our shoulders sometimes. So having a reminder, even if you have to put it on your refrigerator, put it on your mirror, write it on your mirror, and make sure that you're doing some type of affirmation to put yourself first. And what does that look like throughout the day, throughout the week, throughout the month, throughout the year? So go ahead and just think about those little things to implement into your lifestyle. Physical activity, moving regularly, it improves cardiovascular health and reduces disease risks as well. And in the mindfulness and stress management, right, the lower cortisol levels, like activities like yoga or breathing, such as what Denise shared with us earlier, that felt really good. It felt like, for me personally, the weight was literally melting off, and it only took a few minutes. So just balancing that in there. And then again, back to nutrition. We know that diet reduces risk of chronic diseases like diabetes, and it supports overall health. But what does that actually look like, right? So we do know that sometimes when we don't plan for the week, we end up having some unhealthy habits. That's pretty much easy because a lot of times we're on the go, right? And I can speak for myself on that. I know that when I do not plan for the month, then I know that it's going to be a bad month nutritionally. Like on a nutrition side, it's going to be a bad month. So I try to scale it back a little bit and go week by week, because I would hate to go day by day. And at that point, I would probably be at Cane's every day. So with that being said, let's be more mindful about our self-care and preventive plans, right? So moving forward, pretty much just a quick reminder, consider your status today. Do you have health insurance? Is open enrollment beneficial to you? If you have health insurance and it's not, you don't need it, or it doesn't apply to you right now, consider a friend, a family member. Definitely get insured. It's a very important time where I can say that we're entering another year, and in this next year, we don't know what services are going to be covered and what services are going to stay, right? So with that being said, make a plan for yourself and think about the neighbor, think about the next person. Are you taking care of yourself, So this isn't gatekeeping here. We're just sharing all the tools and resources that's out there for us. And with that being said, as we move on, to the BPS model, we also want you guys to know that if you need help getting any type of resources that's relative to anything that we discussed today, please let us know. We're happy to serve as navigators for you. So thank you.
Yeah. And don't shy away even if you don't have insurance. There's a lot of organizations that can find you free pap smears, for free mammograms. And so some of these wellness checks. And so where there's a will, there's a way. Believe me, there is a ton of resources, at least here in Houston and the state of Texas. There's a lot of nonprofit organizations doing the work to make sure people get serviced. So going into this BPS model, which is a biopsychosocial model, there's another one that's biopsychosocial, spiritual, and so for faith-believing individuals. But this is the one that's usually taught in our curriculum. And so the biopsychosocial model is a comprehensive approach to understanding health and well-being that considers interactive biological, psychological, and social factors. So it's developed primarily as a biomedical of health and a holistic way of looking at your well-being and what makes you you. And so whenever I think about mental health, I consider it very layered like an onion because it has a lot of layers. There's a lot of contributing factors, your environments, your friends, your nutrition, your physical abilities. And so all of these contributes to making your well-being you. And so on the biological side, here we have often associated with relationships of disease and bodily health. So here, when we think about aspects to address physical and psychological process that influences health and behavior. This includes your genetics, so family history of genetic predisposition to certain illnesses and conditions, neurochemistry, so imbalances of neurotransmitters such as serotonin or dopamine can affect mental and physical health. Illnesses and injuries, so physical trauma, chronic illnesses, or acute medical conditions. Your brain function, how does the brain respond to stress, trauma, or other stimuli? And then medications and treatments, so the effects of pharmaceutical or medical interventions on your body. And so sometimes we see that people maybe have been clinically diagnosed with depression or have a chemical imbalance. And sometimes the help of pharmaceuticals does help them relieve some of that tension that they have. So here, like after a car accident, an individual might experience chronic pain or changes in their brain function if there is some head trauma that can contribute to anxiety or depression or even a decrease in mental functioning. On the psychological spectrum, here, this component focuses on mind and emotions. So, mind and emotions. So, cognition, we're thinking about thoughts, beliefs, and attitudes. So, um, do I self-criticize? Am I optimistic? Am I pessimistic? Am I constantly catastrophizing things? So, this is like how our thoughts and our beliefs are. Emotions. So, how is our emotional response? Am I always fearing things? Am I always angry? Am I always sad? Am I always anxious? What is influencing my behavior? Um, and then coping mechanisms. So, do I have things in my toolbox to help me process my mental beliefs that go into my emotions and change my behavior? So, like, do I have ways to manage my stress, trauma, and emotional pain? Am I in denial? Am I avoidant? Am I practicing my self-care tools to kind of help me? Am I debriefing things that are happening to me? And then here we also have like the mental health disorders. So like people that are diagnosed anxiety, depression, PTSD, and other psychological conditions. But here, for an example, following a traumatic event, an individual might develop irrational fears or negative thought patterns and exacerbating emotional distress. So maybe for people that get in a car accident and have gotten in a car accident that was really traumatic, then they believe they're always going to get hit. And so whenever they get in a vehicle, they start to flinch and then they start to cry. So this kind of goes into the cognitive behavioral therapy model of like your thoughts rule your feelings and your feelings rule your behavior. So what are you sitting in your mind? How does that affect your emotions? And how do you see that get executed within your behavior? Going down to the social factors, this domain emphasizes the role of environmental and interpersonal dynamics. And so here we're thinking about my friends, relationships, support from family, friends, community, conflict or isolation. Do I not have social connections? Do I not have a way to fit within the social realm? Do we have cultural norms, societal expectations, stigma surrounding mental health? In the Latino community, usually it's not, at least in the older generations, it's seen as normal to receive mental health services because it's like, well, I'm not crazy. Mental health is for everybody that has maybe seen a shift in life transitions, sleep, eating habits, stressors. And so here is life stressors, major events such as jobs, divorce, anything you can think of that is where you would be lacking some social support or face financial strains. And this could increase your feelings of isolation, stress, and impacting this recovery. So the importance of this is that although these all live in a bucket, they all correspond to each other. And so usually when we think like, oh, well, I just got in a car accident, like that was it. But I've been noticing I haven't been sleeping well and I've been agitated and irritated at everybody. So we just went from this catastrophic event of getting in the car accident. Well, hey, I had a concussion, by the way, and hey, I have been irritated. So that's been messing with my social uh, realm of the BPS model. But then psychologically, my mood has been agitated, aggravated, sad, upset, depressed. Um, and so this kind of tells us like, oh, this is all connected. And so when we're thinking about preventative health, we think about what can I do preventatively to kind of help myself in these situations. And so if that does mean on the biological side, getting genetic screening for genetic predispositions for conditions such as diabetes, heart disease, lifestyle interventions such as eating healthy nutrition, exercise, vaccinations. On the psychological side, stress management. So knowing that chronic stress can lead to health issues such as hypertension, heart disease, or mental health disorders. And this is like another one, like, for example, I have a family member that has hyperthyroidism. Hyperthyroidism is highly linked to also depression. And so, for a lot of my people that have this health condition, you tend to see depression butting up right next to it. Um, and so it's important to understand, like, is there some kind of chronic disease that I am dealing with that has been affecting my mental health? And I've just been pushing it off as like, I've been feeling sad, but I don't know why. And so whenever we don't have that why for why we're sensing, experiencing certain things, it makes us a lot more anxious because we don't have a name to it. We're not able to point to the monster in the room that is kind of haunting us. And so here we're able to say, no, I know why. Um, and so, in the social factors of preventative care, encouraging strong social networks. And so, for my individuals that are feeling isolated, feeling alone, and things of that sort, there's many places in the community that provide an opportunity to build social connections. So, like volunteering, or if you want to improve your physical health, I'm pretty sure if you go show up to a yoga class enough times, you'll make a friend with somebody that shows up regular too, and it's going to be waiting for you to show up the next time. And then you start small talking, you start building those friendships. So it definitely takes effort. That's the part of preventative care. You're trying to get ahead of a problem that you're trying to avoid. But the PPS model kind of reminds us like we need to do some inventory. So that is what we're gonna do. So putting it into practice. So if you have a pen or paper, my apologies. We're going to put this into practice. I'm going to go back to the BPS model, and we're just going to take a few seconds. So write down like a biological tab, a social tab, and a psychological tab, and uh, write something that maybe you're doing good at, and then maybe write a thing that you need to improve on. As a reminder, biological is like your genetic predispositions, chemical imbalances, psychological being your thoughts, feelings, emotions, and coping mechanisms, and then social, your social realm of connectivity to other groups, people. And here I'll give you a little bit of a minute to kind of get your thoughts collected. And this is something you can continue also after today's session if you want to continue. But the BPS model is a great way to do inventory on yourself once a year, once every 6 months, just to kind of say, like, where am I? Where are the areas I'm doing great, and where are my areas where I'm being challenged? Um, and so if you want to share, you can. I know this one's a little bit more private since it's like your personal matters. So if you want to share, feel free to share. And I'll just share one on the biological side. So, hyperthyroidism it is a concern within me, my family, and I haven't gotten it checked in a while. And the last time I got it checked was when I was really young. And so I'm definitely like now thinking about it again of like, okay, I need to get this checked because at any moment, like it can get activated. And so just getting ahead of myself, like probably I'm not noticing like if I am having an increase in fatigue and I'm probably claiming it to something else while I'm not checking my biological side to see if this is something that might be contributing or affecting to my mental state and well-being. Anybody else would like to share?
Thank you for opening up about the thyroidism, hypothyroidism. I know that that's something that can be challenging and it could affect you physically, biologically, and you know, socially as well. So thank you for that. I'll share my biological as well. Um, some things that I do really well is going to my annual checkups to make sure I'm not pre anything, right? Like, that's very important to me. Um, Diabetes and hypertension is something that a lot of folks in my family have. So I look out for that. And also making sure that I'm not anemic anymore. There's always a fear that I might not get the most out of the food that I'm consuming, and I just may be anemic to something or the vitamin D deficiency. So those are things that I look for. And it also helps me to remember what vitamins I should be taking or I should switch off of and start taking. Um, so that's something that I keep in the back of my mind. Another thing something that I could do better at is not waiting too long to see a doctor to get rid of like a lingering cough or something. Because, if you have a lingering cough, it could be something chronic, it could be fluid in the lungs and you have trouble breathing and you don't know, and you could have walk-in pneumonia. So it's things like that to keep in the back of your mind as you want to keep up with taking care of yourself and being hyper aware of what you have going on. So that's something that I need to work better on.
Thank you for sharing as well. Is there anybody else that would like to share?
I share in the social realm. I have become very aware of social and community interactions that make me sad or that are very heavily politically motivated. I want to be around more activities that make me laugh, make me smile, make me feel good, and I can leave a meeting and say, "Gosh, that was wonderful." So I have done a lot of distancing myself, which I'm still working on, because it's just such a toxic environment, and I can't handle that with all of the other stuff that I'm dealing with. And I'm doing better in putting myself in environments or in interactions where I can laugh. I can look at stuff and have a. I mean, I even started looking at cartoons because I'm tired of looking at the news and all the other crazy stuff on the news. But just to make you laugh and kind of be lighthearted. I'm working on that. It's something that I'm doing, and I that's the area that I'm working on. On psychological, I have learned. I heard a sermon that said, "Be patient, be calm, and be quiet." And I'm learning that be patient, be calm, and be quiet. And that's hard when you're caring for someone and that someone is always nitpicking and doing stuff, and you want to give a tit for tat for tit, and you have to take a deep breath, which helps me go back to that mindfulness and say, no, I have to be quiet. I have to be patient, and I have to just kind of just take deep breaths and ignore. So I'm working on that. I have been doing so, but I'm going to get a lot better in that. So those are the ones that I wanted to share with the group. Thank you.
And thank you for sharing that as well. And I'm proud of you for having that level of self-awareness of like something's not right here and it's disturbing my spirit. Like I know I'm a cheerful person and I'm just not smiling enough. Like I am not my giddy self. And then kind of backtracking, like why is that? And how is their activity affecting me? And how can I preserve myself in the midst of all of this? And also recognizing like you're a caregiver and caregiver fatigue is a real thing. So like while you're doing the best thing out of your heart, caregiver fatigue is real. And so you do stress and you do get overwhelmed. And we tend to take the tack out of the overwhelmingness of everything that you're handling. And so you don't have an easy role. And I commend you for everything that you do and sending you a big hug on that one.
Thank you. I received the hug. I received it. I received it. It's making me smile. And looking at you all, I'm smiling even more. Thank you.
Thank you, thank you. And Ashley and I talk about that too, like our compassion fatigue that we tend to feel because we're such caring individuals. Yeah, you included, Dr. McCullough. All such caring individuals that we have a problem-solving mindset, and so we want to automatically solve problems that people didn't even ask us to solve, but our mind automatically goes into, I have this resource, I know this person, I could do this and I could do that, and so that we tend to drain ourselves out not paying attention to, yeah, and then I wonder why ever overwhelmed all the time. But yes.
Yes, snaps to that. Thank you for the reminder and thank you for that nugget, Dr. McCullough. Be patient, be calm, be quiet. Thank you for sharing what you received out of a sermon that touched me completely. And
Mhm.
like Denise said, we have these conversations a little too often,
Yes.
but not often enough, rather.
And
Thanks
so
for sharing.
and
It's just
on
good to share.
Yeah, that is true. And like I mentioned earlier, there is a BPS model that includes your faith and your spirituality. So for me, that's a model I've used too. So like, oh, how's my relationship with God? Is there things that I could be doing in the kingdom to kind of help myself propel forward and my faith and just how I feel in that part of spirituality. So that's another bucket you can add on here if that's what you're interested in. But thank you everybody for participating in that. And then wrapping this up, just is there any questions or comments about today's discussion about preventative care, self-care, things we've learned that can kind of help us come to a close?
Thank you for having this session. Thank you for continuing to reach out to us. It has been so very helpful to me, and I will look forward to more. And I'll look forward to sharing this recording with my niece and her baby. But I thank you. It's been awesome. Thank you, thank you, thank you. And now I can kind of go back and reflect on some of the things that we talked about and have a better night's sleep. Thank you.
Thank you. Yes, definitely. Just having this presentation whenever Ashley brought it up to the Be Nurtured board and telling me like, hey, this is what I want to do. Even I had a hard time initially conceptualizing like, okay, what do you mean like preventative care is self-care until we like went through the slides and we talked about it and we're like, okay, like you're talking in a different lingo, but we're talking in the same about the same thing, just like in a different way, because I understand it in the clinical side of like BPS model, but also understanding like the social factor of like our structures and how we can get accessibility to healthcare services and things of that sort. So it's very helpful to just have this information and then sharing it out to our community as well.
Definitely. Thank you so much, Denise, for creating this space. There will never be a time that I don't tell you that. I appreciate you so much for developing Be Nurtured and having us be a part of it. Um, there's a lot of times that we forget about, like, we don't zoom out. We're always zoomed in. We're always in the micro, but we don't think about the macro, right? So systems thinking wise, you being on a mental health side of things and me on the other sciences and the public health side of things, we think of system thinking, right? So a big thing that I love that everyone in Be Nurture has is that collaborative um, welcome that, a lot of time that we forget. So it kind of just fits the puzzles and it creates something awesome like this. So thank you.
Thank you. Thank you for sharing. And as always, thank you all for participating in today's discussion. If you like what you saw today and are interested in everything else that we do have workshops. We have this webinar. We have a podcast that's in my field, but I'll heal. If you're in Houston, we're going to be working towards our community connection. And so meeting organizations, nonprofits, business owners, they kind of want to share their experience and some of their challenges and some of their achievements with us when it comes to connecting with our community. So that social aspect. So we want to come out to you. We want to see what you're doing here in the community. But thank you for joining us today. Bye, y'all.